Hello everyone, hope you're doing well. Welcome to Chapter 9, Health Communication. I think you're going to really enjoy this chapter. There's some really important points in here, especially from a legal perspective that you need to understand when talking about anything healthcare related. So as we transition, I hope you enjoy it, and I hope we all learn a little bit together. There's only about 15 slides that are really important in here, 19 total. So we'll go through this in correspondence with a textbook. Chapter 9, of course, starts on page 317, health communication. So we're going to define what health communication is, trace the development of health communication, how it has really changed. And this is really interesting. You think back 20 or 30 years ago, no one even knew what HIPAA was. Of course, HIPAA, I think, came out in 1996. A little more information coming. So it's a little over, I'm dating myself, a little over than 20 years ago. If you think back in the 80s, 70s, 80s, this is not something that we would have thought about in relation to keeping people safe and privacy. Describe various components of the healthcare system and analyze some key systems that influence communication in healthcare settings. So health communication, very interesting organization, describes or defines health communication as a state of complete physical, mental, and social well-being that is not merely absence of disease or infirmity. So that's what health means according to the World Health Organization. You have this real big push right now for population health. Exercise, maintaining a proper lifestyle, making sure that you remain healthy, not just free from sickness, right? Health communication is the creation of exchange of verbal, nonverbal, and written messages designed to engage and influence a variety of audience in order to increase understanding and, of course, influence behaviors. So how does your provider communicate with you? How do you communicate with people that are going to help you maintain that World Health Organization definition of complete physical, mental, and social well-being? Healthcare is not just physical, right? There's also mental health, emotional health. There's a lot of health that goes into everyday lifestyle, right? Social health. So where you live, what kind of money you have to provide for yourself, a lot of different elements to that. The system is massive. You have a whole lot of large healthcare organizations. I even work for one. It spans numerous different states. There's numerous things that go into providing healthcare. Healthcare is not always a lucrative thing for businesses to be a part of. Now, there are some lucrative, parts of healthcare. When you're looking at cash-based services, home care, maybe some drug, pharmaceutical industries, but the majority of healthcare operates pretty flat. So, when you hear a lot of these healthcare systems struggling to make it, that's one of the reasons. Providing healthcare is very expensive. It's very complex. There's a lot of healthcare organizations. This is a little bit of a highlight of that. Focus on healthcare delivery, as I just talked about. What about financing and regulating health systems or health services? There's organizations that specifically do that. You get professional organizations. One example is the American College of Healthcare Executives, right? I belong to that organization, or I used to. That's where, healthcare administrators get together in order to share ideas and share common practice. You have things like research and policy organization and information and advocacy organizations. That's really important, especially when you're wanting changes, right, from the federal or state level. We really use our information and advocacy organizations to help make those changes so lawmakers understand the impact of their decisions on healthcare operations. So parts of the healthcare system, you have pharmaceutical companies, which I just talked about. They play a crucial role because they manage the medication side of things and they help set prices, right, for those medications. It is very expensive to deliver healthcare in the U.S. One of the reasons is pharmaceutical cost, and there's a lot of different regulations that play into that, which makes the cost high. However, there's a lot of upcharging, which is a debate on the federal level to figure out how and why that's the case. So insurance companies also have managed care for large systems. So managed care plans, which is a type of healthcare plan, is designed to provide health care for their members at a reduced price through contracts established between healthcare providers and medical facilities. So I have a managed care plan through Premera that is strategically, I'd have to go to a Providence location to receive care in order to be in network. So when it's in network, it's cheaper because we've already negotiated rates, or Providence has, with Premera in order to encompass a cheaper rate for people that need healthcare services. So that's a managed care plan, and I think it's helpful. A lot of people that have insurance have managed care plans. So you have an insurance carrier like Premera who contracts with a large healthcare system like the one I work for, and they work back and forth in order to have a decreased cost for their members. To more about the healthcare insurance world, we'll learn about that in law and ethics. When you have a law and ethics class, we'll talk about that, and I look forward to learning more with you there. Healthcare system, right? We talked about the Health Insurance Portability and Accountability Act, HIPAA, HIPAA, not HIPPA, which some people confuse with it, right? It's designed, of course, to lower healthcare costs, but it also talks about privacy. So HIPAA protects you. It really protects, like we were talking about, privacy, but also, there's a lot of information that goes back and forth from making sure your information is not given to people who might want to use it for the wrong reason. And also it really regulates why and how providers communicate with their patients. So you can't really, if you treated someone for behavioral health, you can't go out and talk to someone else about it. There's protections there, or any other thing for that matter. You can only discuss that kind of stuff with other healthcare providers that might be in the line of care for this person. So the ACA is also another important component of the healthcare system, right? The Affordable Care Act helped give healthcare to a large majority of people who are struggling to achieve it. And also in that continuum, Medicaid expansion happened, which provided more healthcare coverage for those who needed Medicaid from the perspective of the state side of things. So something to look at, something definitely to keep an eye on as things go on. We look at this from a cost basis as well, and there's a lot of information back and forth to try to figure out how to make healthcare affordable in the U.S. And we've talked about pharmaceutical companies being, so expensive, maybe upcharging, but our structure also is challenged in that regard. We have the lowest lifespan and spend the most for healthcare. And there's a lot of reasons for that, but we should explore ways to improve that moving forward. Not something for this class, of course. So let's define public health. We're going to talk a little bit about health campaigns, some interesting things there. Explain the role of influential messengers, interpersonal influencers in health campaigns, and then how stigma and disparities can influence health communication in different communities. So from a public health perspective, public health promotes and protects the health of people and communities where they work, learn, and play. A health campaign is a strategic effort that creates messages to influence a target audience, attitudes, beliefs, or behaviors related to a healthcare issue. You hear about this a lot, especially from the perspective when a new president starts, right? Sometimes the first lady will say, I have a Get Out and Play initiative. And I think it was Michelle Obama that had that a few years ago. The Get Out and Play initiative, which helps, kids, right, go outside, encouraging that from a different perspective, helping decrease obesity, decrease diabetes, all that stuff that goes with, getting out there, being active. You see that from a health campaign perspective. That's just one example, and we'll talk about more as we move forward. Influential messengers and influencers are all part of this. So what is stigma? Stigma is a socialized view of a disgrace that targets a particular group and is based on stereotypes that mark individuals from that group as different. So you have a stigma. Maybe there's a stigma for a group of people that we need to work on from the healthcare perspective side of things. Health disparities, of course, are preventable differences in health that really hinder people from being where they should be from a health perspective, and then also it really impacts socially disadvantaged groups. So part of that is, and the reason why the ACA was so popular was, those who needed healthcare coverage often couldn't afford it, and by opening the ACA and Medicaid expansion, we were able to eliminate some of those health disparities by helping people get the healthcare they need. So health disparities were one of the things that was really huge that came up when the ACA was being pushed back in, I believe, 2010. Well, really 2008 to 2010. I think it was enacted in 2010. All right, let's move to 9.3, health communication in relationships. Take a look at this learning objectives here. We're going to move. I got a few more slides to go over. But provider to patient communication. That's communication that happens, of course, really simply. This is page 335. This is information that is exchanged from the provider to the patient, or maybe the nurse to the patient. So a provider thinks about, hey, I need good bedside manner. I want the patient to feel comfortable. I want to be able to give information that's not too complex so the patient understands it. And from the patient's perspective, they try to communicate their health issues to the provider and try to get um, information that they need in order to be happy, healthy, and secure. So there's a lot of supportive conversations that go on that's enacted by different partners. Maybe family and friends are there with the patient to help them cope with certain information that they might receive. And also, part of this too that I want to keep in mind, a lot of times provider-to-patient communication has disparities within itself, and this is not something that I see in the next few chapters, but or the next few pages, not really chapters, because we're only talking about health communication in chapter 9. But a lot of times there's a language disparity, and making sure the patient has an effective interpreter there in order to understand exactly what the provider is saying. That's really important, something that's often lost in communication, but that would be health communication at its finest, making sure the patient understands what the provider is trying to say and says it in a way that the patient can really reap the benefit of having a healthier and more supportive conversation. So caregiving is a very important part. Those caregivers that take care of us when we're at most need. It's been studied, of course, in different ways from the perspective of how do we communicate when we're caregiving. Caregiving happens, of course, through a person's life. It's a social exchange, and there's cost rewards in that relationship. There's caregivers that can be in the home. Maybe it's a family. Maybe there's a caregiver that comes to the home, like home health for a patient. That's important because you're stepping into a different element of care. You're inside the person's home. You might need to adjust your health communication when you're there. But maybe caregiving also is from the long-term care perspective. Maybe the patient is unable to leave 24/7 care, needs to be in a hospital or a long-term care facility. Maybe they're in swing bed and they're moving from acute care to home, and caregiving can happen on a variety of different time continuum. Sometimes it's very costly, sometimes it's stressful. You need to cope with those as a provider in order to deliver health communication in an effective way so people understand. All right, 9.4, finishing up. Health information seeking behaviors are intentional actions triggered by a perceived need for health information, right? And we talked about this from the perspective of the patient, making sure they understand different severities of the illness, making sure they understand the psychological factors, and maybe they don't. Maybe they have dementia, maybe there's Alzheimer's involved, where you have to bring in a family member in order to communicate effectively with that patient. But study a little bit more about health information seeking and help make sure that you understand this as you transition to a healthcare provider. Because when we say provider, that's a global word. Most of the time I'm talking about actual MDs, APCs, practitioners, but we're all in a way healthcare providers if you provide care to patients. And from that perspective, as a radiology tech, you're moving into that sphere. You're providing healthcare, maybe at the, of course, doctor's order, but you're there for the patient, and the patient sees you as one of those healthcare providers. So you have to make sure that you're delivering information in a way that is succinct with, of course, what the provider told you to do, but also succinct with being able to communicate so they understand it. So patient-centered communication, you're going to talk a lot about that. Take a look at it from the perspective of empathy. We want to make sure that we really think about how we're talking to patients, and research on patient-centered communication has shown that it leads to positive outcomes. So put the patient in the center of any equation, and you're going to come up with a good outcome. What's best for the patient? What's best when I communicate? And how do I communicate best? We talked about interpreter services, and we've talked about a lot of different elements that is important to understand so we can relate and give the information needed for the patient to be healthy, happy, and successful. Well, I took up an entire 15 minutes going through this one chapter, but if you need anything from the perspective of health communication, be sure to take a look at the rest of chapter 9, and I look forward to hearing more about it. Health literacy is something that we're going to talk about, of course, I think, as time goes on, but making sure you have the social skills and the ability to find, understand, and use health information in order to promote and maintain health. Take a look at that in the chapter as well. We'll end on that. I appreciate all that you're doing, and I look forward to hearing more about your questions related to health communication.